after he witnessed his mother's experience with having her teeth extracted and having dentures made at a young age, he made a commitment to never extract another tooth that could be saved. Many consider Dr. L.D. Phankey the father of modern-day restorative dentistry. And I don't think that's too bold a label for Dr. Pankey, because of the influence that he had in his career to really develop and pioneer everything related to restorative dentistry. You know, before Dr. Pankey's time, dentistry was really the art of exodontia. You know, if you think of what dentists did, say, before the 1920s, what they did was essentially take teeth out. And Dr. Pankey wanted to save teeth. You know, if a tooth was savable, he wanted to save it because he saw the devastation firsthand, saw the devastation of what would happen when people lost their teeth. And it really set a downward spiral of not only dental health deterioration, but overall health deterioration. And it was his mother, Dr. Pankey's mother, who had all of her teeth extracted at a young age. She was in her early 40s when she had her teeth extracted, because that was what was done those days. And it's hard to believe that, you know, that was the thinking, but that was the thinking back then. And when Dr. Pankey realized the devastation that his mother had experienced when she had many, many healthy teeth, you know, and there was things that could have been done restoratively for her, that he committed himself to never. So he made a commitment after he witnessed his mother's experience with having her teeth extracted and having dentures made at a young age. He made a commitment to never extract another tooth that could be saved. And he followed that for the rest of his career. He'd extract a tooth if it could not be saved. But if it could be saved, he would never extract that. So talk about a bold move, and talk about someone deeply committed to values. That would be Dr. L.D. Phankey.